everybody, I'm Dr. Stephen Cain. I help people with peripheral neuropathy get out of pain and back to doing the things that they love doing. One of the ways that I help is by providing you with this video educational series that gives you tips to help give you some much needed relief. This particular video is about a clue that can help you determine what's causing your neuropathy. And this is extremely important because if you don't know what's causing your neuropathy, well, then it's going to be extremely challenging to truly get yourself better. This clue pertains to where you feel your neuropathy symptoms, the distribution of your neuropathy. Now, there's two primary causes of neuropathy. There are compressive lesions or pinched nerves, and there's also metabolic-induced neuropathies, things like diabetes or alcoholism. And these two different causes have distinctly different patterns in which a person will feel their symptoms. If someone has a compressed nerve or a pinched nerve in their body, they will feel their neuropathy symptoms of burning, the numbness, the tingling, only along the distribution of the course of that nerve. For example, if someone has a pinched nerve in their low back, let's say it's their L4 nerve root right here, coming out the back, right there. Let's say this guy right here is getting pinched down on. A person will feel numbness on the inside of their leg and the inside of the foot, because this is where the L4 nerve root goes to innervate the body. There's plenty of places throughout the body in which a person can have a pinched nerve, and all throughout it's always going to affect just the distribution of that nerve. And this is almost always going to be non-uniform. It's not going to envelop the entirety of the foot or the hands, but rather it's going to be just a portion of it that that individual nerve covers. Now, if this is the case, if you do have a pinched nerve in your body, then the best forms of treatment most of the time are going to be chiropractic and or physical therapy. This mechanical approach is extremely effective, it's not invasive, it's safe, and it gets at the root cause of the problem. Now, if someone has a metabolically induced neuropathy, diabetes, alcoholism, too many medications, chemotherapy drugs, just to name a few, in these cases, vast majority of the time, their neuropathy symptoms are going to be felt in what's called the stocking glove distribution. This is where someone will feel their symptoms starting off in their toes, coming up into the foot, into the leg, and then ultimately into the fingers and the hands, as if someone's putting on a pair of stockings and then a pair of gloves. Now, this type of neuropathy does not attack any specific individual nerve, but rather it attacks all of the longest nerves in the body, which is why it's also called a length-dependent neuropathy. If this is a type of neuropathy that you have, in most cases, diet and exercise are going to be absolutely crucial to improving your metabolic state and getting at the actual cause of your neuropathy. So these two different types of neuropathy, the compressive lesions, which will most likely correlate with a non-uniform neuropathy, and the metabolic neuropathies, which will have a uniform neuropathy enveloping the entire feet and ultimately, if it works, up into the hands. Now, it does get a little bit more complicated because there's another type of neuropathy called mononeuritis multiplex. This is where there's multiple individual nerves throughout the body that are being pinched down on. And this happens because there is an underlying inflammatory condition, something like Sjogren's or lupus or sarcoidosis, to name a few. This underlying inflammatory condition essentially pushes it over the edge. So there's already a nerve that's close to being pinched on, and this extra inflammation, this extra pressure in the body pushes it over the edge, creates this compression on the nerve, causing the neuropathy. It can happen many places throughout the body. It could happen on the inside of the elbow, causing the neuropathy to go down the inside of the forearm and into the hand on both sides. It could happen in the back, causing a neuropathy that radiates around the ribs to the front. It can happen many different places. Now, this neuropathy is essentially both combined. There's a compressive aspect, and there's also a metabolic aspect, or this inflammatory condition. Hence, to address both of these, you want to do both the physical therapy and the chiropractic, as well as the diet and the nutrition to attack both angles of what's causing this mononeuritis multiplex. So there you have it. Wonderful information. If you leverage it, what's causing your neuropathy can work so much smarter and get yourself better. So apply this information, apply all the other information that we have on our website and on our social media, and in time you will be feeling better, and it means a lot to me to help make that happen. So have yourself a wonderful day, everyone, and I will see you in the next video. Take care.